And we are off. Thank you so much. So, thank you for joining me for channel First Mate Green of the UK. I'm your host, Mate Green of the UK Cannabis Community, now at Croydon University Hospital with my father with his bowel cancer appointment. Just trying to find out in more detail.
Like this, and there's another chair behind here. Another one of you want to sit there?
Yes, perfect.
Yeah. And you can sit here. You have enough space.
Thank you
for
so
to
much.
Move around.
Can you come?
If you want to walk in, then I close the door.
Yeah, okay.
It's a bit tricky.
It's okay. Thank you for managing us.
That's all right.
Okie dokie. Would you like to come
Thank
in?
you.
You're welcome.
So, you've been called in mainly to kind of go through a bit of things again and see how you're feeling about the plan still. So, how much you remember and how much have you understood of what we talk about?
How much do you remember? How much do you understand that? You understand that you have to do your exercises every day, breathing exercises, to build up the strength in your body and your and make your heart stronger. So he's doing regular exercises.
And you still feel positive about the surgery?
Yes, but the one thing is bothering him is that he is fearing that if there's an option that he may lose his life. And apart from that, the bag that would go on, that's really bothering him. He doesn't want to have that at all, if not definitely not on a permanent basis or for long periods. So is there, I know you can't give any guarantees until you've actually started the operation.
I will try and get the surgeon to come in and speak to him. The thing is that it's, when they do the joining, especially with certain age and certain complication, it can be a bit difficult to make sure that it's well sealed.
Right.
So that's why they normally do a temporary bag.
Okay.
In terms of ensuring there is not going to be any leakage around the stomach.
Okay. So
if you want, we can arrange for you to see the stomach nurses. Have you seen them at all?
I don't think so. I don't
and they can explain you a bit more about the stoma and the bag and how it works.
That's what it's called,
and they
the
can
stoma.
show you, yes, and they can show you the bag. Yeah, let me just wait.
So they will make an appointment for us to see the specialist who will explain the bag that goes on to you when they do the operation. Temporary bag.
Temporary or permanent.
Ah, okay.
It could be that it stays there forever as well.
Really?
It all depends if they think they can join it again.
Okay. But we are trying for him to do as much exercise and obviously build up the strength and his...
Dr. Lambert, the one in the little room that you saw before me last, what was it, 13th of August? A long time ago.
Yes.
Very calm voice, and he probably went through the risk of the anesthetic.
That's right, I spoke to the anesthetic
and he
person.
gave you the mortality risk, because obviously with your condition and your heart and all of that, there is a risk of it. A younger and fitter person would have less problem going through this surgery.
Right.
That is quite straightforward. But obviously when you're having heart problems and things like that, even just making you sleep can give you some risk.
Right, okay.
That's why you needed to have a chat with the anesthetist.
Yes.
To see whether if you were fit enough to actually go through a surgery.
Right, okay.
And Dr. Lambert said that yes, there are risks, but you are fit enough to go for the surgery.
Brilliant.
And you will need to have a closer observation after.
After the first operation?
Yes, and you will need to be in a high dependency unit.
Okay, that's your
Yes.
recovery unit.
The recovery is in theater, and then you will
Okay.
probably spend 1 or 2 days in a high dependency units, like ITU, HDU.
Okay.
So they kind of, you have your own nurse, you got all
Alright,
these
okay.
drips going on, and all the monitoring of your heart.
Right.
So
Will this
at
be
least you can be close monitored.
in a ward or in a room sort of thing?
It's different. In HDU, it's a department where all the patients need extra observation. That's why they
Okay.
kind of have just one nurse for each patient.
Right, okay.
It's a room with 7 beds.
Okay. So you have
By
the
each bed, you
cubicles.
have your yes, you've got curtain that you
curtains.
can close around,
Okay. That's fine.
and every nurse is there beside their patient so they can monitor everything.
Okay.
Because you will have a lot of infusion and things. I'll go and see if the stomach nurses are here.
Okay.
And if they have time to see you.
Yes.
Because I think that will give you maybe a bit more reassurance on how
more
things
understanding
can
as
be.
well.
Yeah, exactly.
So shall I move?
No, it's alright. I can manage. Yeah, just wait a moment.
Okay. Thank you.
नहीं तो कह रहे डिपेंड करेंगे अभी सिर्फ समझा रहे कि टेम्परेरी लगेगा
So I'm just in hospital with my father and my auntie mum. Show your face. That's my father. I'll show you face of my mum. And we are just with the enhanced recovery team nurse who is explaining to us about the bowel surgery procedures and getting us trying to see if she can get us an appointment booked with the bag specialists who will be attaching the bag to my father after the first operation, depending on how well his body is and how strong his heart is during the operation. That will result in whether it's one complete operation, 2 operations, or cutting out the bowel cancer. That's the first operation. Then they have to do another operation of reconnecting the 2 cut out bits together. And they're saying if the heart's strong enough, then they can do the 2 operations in one go. Otherwise, it has to be 2 separate operations, 1 to 2 hours each operation. And in between, they'll have to put a bag for either temporary or permanent time. But hopefully we will try and keep him as fit as possible with regular exercises and breathing exercises to pump up his heart and build up the organs up until the time of the operation. So we're going to do our best to he's changed his diet as well. He's eating healthy and he's doing regular exercises on a daily basis. So we are trying our best to keep him on the positive side of things, and then hopefully we shall find out what else happens.
They're not in the office. I'm going to kind of give them a little call.
Okay.
Because obviously not having an idea of what it is gives you a lot of question and worries.
Yes.
Thank you.
Oh, I forgot the number here. 563.
This is the launch inter- Thank you. Please enter.
So,
Your paging request is accepted.
Mr. Mohammed will try and come and have a little chat with you. He can give you more information in regards of whether the stoma bag
Okay.
will be needed as a temporary or permanent way.
Okay.
But, so do you know what it is, a stoma? It's going to be a part of your bowel that's going to be brought up to the skin, and then you will have a bag over it that kind of collect your feces. So the stool, the poo, will not come from your back passage, but will go in your bag.
Direct from
Yes.
the stomach, from
Yes.
the bowels. So he won't have the feeling of wanting to go to the toilet?
No, it will just come out automatically.
Okay, so you'll just have to manage and keep an eye on the
Here,
bag to
we
see
as
how
the
quick it
person I'm
fills
trying
up.
to get in touch is the stoma nurses,
Stoma,
and they're
that's the word, stoma
specialized in
nurses.
it.
Okay,
So that's their specialties. All they do is help the patient that are having the stoma in managing it. So they will be seeing you when you're in the ward,
okay,
and they will try and teach you how to do it and make sure you're able to look after it and able to change the bag
okay.
on your own.
Is it something that he'd be able to do on his own, or does he need assistance with the...
It all depends
I
on
would have
him.
thought that he needs assistance because it's... If he...
Are you able to with your finger you're okay?
Yeah, fine.
Yeah, you can do things and like peeling off dressing. Will you be able to like kind of peel off something?
आप बैंडेज वगैरह उतार सकोगे? नहीं बोलो.
Yeah, I can't do it like
Very difficult. It's very difficult for him.
Yeah,
It
but you
has-
know they can organize. That's why the stoma nurses would see him regularly.
Yes.
Decide whether if he's able to do it on his own.
Okay.
If they then see that he's not, they would then organize support at home.
Okay.
So sometimes patients go home and have carer going in to help them change the bag or empty the bag.
Right. Okay.
It's something that they can teach you if you want to. Yeah, if you
Yes,
feel like
yes.
it's something that you can do for him, they can teach you a little bit. They will still maybe give you carer to come in.
Okay, Mum.
And then-
They will teach you how to change the bag and everything.
Okay.
Yeah.
Another thing, what was the question I was just about to ask you? About the house. When the operation is done, as
Yeah.
I said, he's got 5 sets of steps
Yeah.
to go up to his flat.
How did you get in touch with the council?
She did get in touch with the council, and they've said
they will be fine. But if you can make letters, it's very easy for us.
because the first property they showed had damp walls.
Yeah.
And they have said to us, well, you refused our first offer, but if we have it on paper that says that he should be given accommodation that doesn't have damp walls or something that's going to affect his health.
Did you tell them
Then-
the new diagnosis he
Yes.
has?
Yes.
Yes.
Yeah. Do you have the letter from my colleague? Have you received the letter home?
No.
No. I mean, presenting that letter to the council, hopefully that should prioritize what type of help is needed, and hopefully more efficiently, because I assume the operation will
Yeah.
be taking place pretty soon. How long will you say roughly it will take before the operation takes place?
So at the moment we are doing already list at the end of September, so it probably won't be this month.
Okay. Probably be sometime.
It will be either very end of September or
beginning of
next
October.
month. Yeah,
Okay.
yeah.
All right. So we've got that much
Because
time.
you know
to
the
work
doctor are
towards.
not doing surgeries every day.
Okay.
Because they do the surgery, they do the clinic, so that's why the doctor, his doctor, do surgeries just on one day.
Okay, and that's the Thursdays.
That's
that
correct.
They do the operations
Yes.
on
Yes.
Thursdays. I remember you said, and that would be Mr. Mohammed that
Correct.
would be doing the
Yes.
operation.
Yes.
Dr. Mohammed.
Yes,
Dr.
Dr.
Mohammed.
Mohammed, yeah.
Okay, and he's one of the surgeons. If it's him and his Mr. Shiva Ram or something, Sai Baba, I think it was his colleague. They said one of the two.
Saeed is Mohammed, is Saeed Mohammed.
Oh right, okay, it's the
Yeah.
same person. then. I
Yes.
thought it was two because they said to me if it's not Mr. Mohammed,
Or
then
maybe Arun Shanmuganandan.
I haven't heard that name before. But I think they said Sai Baba or something like that. That is
Yeah.
his colleague.
Come in.
Would you like Mr. Mohammed to come or?
Yes. Sorry.
It's okay.
अगर कोई तुमसे हो जाते किसी और को ऑपरेशन तो फिर भी इन्हें बुला सकते हैं.
Yeah, depending, but they're saying that roughly It's going to be by the end of September, beginning of October. So it's definitely not happening anytime soon this month, but possibly end of September, beginning of October time. But that's the soonest possible they can do it because of COVID and everything. Their surgeon is doing operations just on Thursdays, and then he has to look after the clinic and the other patients where they go and check and monitor the patients they've operated on. After operation, you wait in the ward for the doctor to come around to visit you and to explain what's been going on and what's the next course of action. So they're saying that once a week that doctor will come and do the
Mohammed is
operation.
just finishing one thing and he will come as well. So he can answer some of your questions as well.
Okay, thank you.
In regards of the letter,
Yes.
I will, when I go back to my office, I will do one and I'll send it by post to you
Okay.
so that you can present it to the council.
Yes,
Would that be
please.
alright?
Yes, please. That would be brilliant.
So that
If you could
this,
possibly do maybe 3 copies of it,
yeah,
if possible.
yeah.
It saves us taking it to get it photocopied. It's already
Yeah, sure.
done.
So at least you can have one, you can
And-
send one,
yes,
and
please.
so on. Yeah.
Yes,
No,
please.
that's understandable.
Saves the hassle.
But did they say anything about timing or when is it going to be? Did they tell you anything at all about the housing?
About the accommodation. She's asking you. आपसे पूछ रहे हैं कि आपको कोई information पता है चलिए इसके बारे में.
No. That's the unfortunate things with housing with the council.
Yeah.
But the physiotherapist
Yes.
will see you when you're here. They will assess your mobility.
Okay.
They'll make sure that until you get a new place,
Yes.
you will have enough assistance at home.
Okay.
Yeah. Obviously, it will be difficult for you to do. It's difficult now for you to do all those stairs.
It is. Yeah.
So after the surgery, it will be impossible for
Yeah.
you
I'm sure.
because you
it's
will
gonna-
still be recovering.
Yeah. You don't want the
In
stitches
regards
to
of
rip open.
going in from here, is not a problem because transport they
Okay.
do bring people upstairs.
Okay.
Yeah. So if when you are in the ward and you're fit to go home,
Yeah.
the staff in the ward can do a note.
Yeah.
And say he needs to be brought up 5 flights of stairs.
Okay.
Yeah.
But that could be risky for his stitches, no?
Hmm?
Wouldn't that be dangerous for his stitches to reopen up because
Well-
of the amount of steps and where the incision would be made?
It will be enough time. I mean, it won't be going home straight away. At
Right.
least he's gonna spend 1 week here,
Right. Okay.
and it will advise him to hold his tummy.
Okay.
You know, and they actually use a specific chair to do that. So they trained on how to handle.
Okay. They'll be carried up instead
Yeah.
of him putting
Yeah.
the effort to strain.
No, exactly.
Okay,
You
okay.
won't be doing anything.
Okay.
You'll be like a king on your chair,
And they will
and they'll carry you
him up.
upstairs.
And then
And obviously, once you're in your flat, then at
Yeah.
least you can move around,
Try
and
to
do a bit
move
of
about.
things.
I think he
Yeah,
has a walking frame indoors that he could
that's good.
use
That's
to
good.
walk about, which he does sometimes. When his arthritis is really bad, he uses the walking frame to go to the toilet and walk in the passage. Because it's just a passage, maybe slightly longer from this corner to that corner is where the toilet
Yeah.
is. So there's not much space to walk about. But
Yeah.
yes, we definitely need a place.
It's just about safety mainly.
Yes.
So I'd rather him walking less than I would ask someone else
Mhm.
than putting himself at risk with the stairs.
Yeah. Yeah.
So that would be temporary until the flat is
Until
sorted
the
out.
accommodation gets
Yeah.
sorted out. But this letter would hopefully definitely push things
Yeah.
a bit
Hopefully, yeah.
forward a bit more and hopefully prioritize.
Hello there.
Hello,
Hello.
how are you?
Hello. No, it's fine, it's fine. Hello there.
You're Dr. Mohammed?
We met.
Yes. Oh,
We
yes.
haven't met.
Yes.
How are you?
I'm good.
You
This is
alright?
my mother.
Okay. We brought you here today really to talk about the operation.
Yes.
All right. It's a big operation.
Major operation.
Yes. And we know you have, health problems. Okay. So we want to do things that will treat the problem, but not going to put you under a lot of danger.
Okay.
Okay? So, as well, last time you came, we showed you the pictures and where the problems are.
Yes.
So, lower down in the bowel, that's where the cancerous growth is.
Right.
So, what we normally do, we remove that
Mhm.
and then join the bowel together.
Okay.
Okay? It's a
Okay.
big operation. The biggest risk of the operation is the joint. Sometimes the joint,
The second operation.
yeah, the joint doesn't heal very well. It can leak and it can lead to problems.
Okay.
And if you're not strong enough, if there's a problem with the joint, that's almost will finish you off, to be honest with you.
Right.
But that's what we generally do for this sort of condition. So knowing your health problems and everything, one of the things that we have to think about is that we need to get the cancer out, but not
As
take
soon as possible.
any risks. And that means really removing the cancer, but not joining the bowel together. And that means you having a bag.
Okay.
It's called a colostomy. You understand what that means?
Colostomy, is that the name of the bag or
Yes.
the procedure of attaching the bag?
So the colostomy is the process of bringing the
process.
bowel to the surface. It's called a colostomy. So
Okay.
instead of going to the toilet in the normal way, okay, you will have a bag here. So you will have a bowel sticking on the side of your tummy,
Mhm.
and poo will come through that.
Right.
And you will have a bag attached there, and it empties into it.
Is it the size roughly of the bag? Would it be heavy? Would
Yeah,
it
that's
be
why I was saying to you that
Not-
maybe
not-
difficult for him to manage?
No, I mean, last time I remember you guys do everything for him. He told me.
Mhm.
Because I asked him, I said, what do you do for yourself? He said, he turned to his son, and you went here, but mentioned wife.
Yes.
Do a lot of things for him. So,
Yes.
So I know having a bag is not easy, and, sometimes mentally it's difficult to get
Yeah.
around with
Mhm.
the idea. But I don't want to stress him too much. He's not very strong.
He needs
He's
to-
had a heart operation. His mobility is not great. If I remember, you're diabetic. Is that right?
Yeah, diabetic.
Yeah.
Diabetic
So
as well, yes.
he's not in a good health.
Mhm.
And I don't want to do anything that increases the risk. By what I'm proposing, which is remove the bowel, not join him, and just give him a bag, is less risky than trying to put everything back together. It means there's a new situation which he has to get used to, you have to get used to, okay? But it means the risk to him is much less.
But will he have the bag on
It
permanently?
will be permanent, unfortunately.
Ah,
Oh, I don't want it.
that's one of his main concerns. He doesn't want to go through the operation.
Because I
if it's a
don't like it,
permanent
like-
thing.
Yeah.
He
I don't
knows
like
of
it.
he knows of someone who's a lot younger
Got too
and
much
had
tension and
had
don't-
the operation,
Mhm.
and it's difficult enough to see them living with the bag and the difficulties they have, and
Yeah.
knowing that
Well,
he's
if we arrange the meeting with the stoma nurses and we talk, and you can talk about it with them, they can give you some more information about it.
that's all good, but like you said, he does not
Yeah,
want to
I
have
think
the
that's
bag.
a very, as I
on
said, it's
for
all
permanent.
mental thing, accepting, okay?
Mhm.
You have to,
So
I'd be
he's
happy.
got a little bit of mobility at the moment.
Yeah.
When he has the bag, then the mobility would cut down even more. He'd be feeling embarrassed about traveling places because
Not
he's not
necessarily.
able to.
Most people don't know what's hiding under your clothes.
Right.
So actually nobody would know.
Okay. But then he wouldn't have the feeling of wanting to go.
No, he won't. Actually, he'll have a better
and-
control. Because, at the moment, going to the toilet is an effort.
Mhm.
All right? But actually having a bag and emptying it, he can go on a long journey on a car or a train or whatever. He doesn't need to think about going to the toilet.
Right.
Because, so for people who have mobility issue, actually having a bag can be a liberating thing. Because So there are people who have urgency constantly, they need to go to the toilet and can't control things. So it doesn't necessarily, there is a very good chance actually, the biggest problem with the bag is acceptance mentally.
Yes, I understand
Okay.
that, but he does not. He's
Yeah.
made it completely clear that he does not want to have a permanent bag attached. So if there's a possibility that the bag will not be attached, then he is compromising whether he should go for the operation or not, depending on if whether the
Well,
bag's going to be
I think
on.
that's
it's
a
gonna-
very big deal, because the problem is if he doesn't have the operation, the cancer will get worse and that will get to him.
Mhm. But then how long will that take?
This is the problem.
Compared to him dealing with and coming to a new life of carrying himself
Yeah,
with a bag.
Having a bag, as I said, is a new situation one has to get used to.
Yes,
All right, but it's not a death sentence.
it's a big change.
But it's not a death sentence.
No, it's not. But
A
it's
cancer
still
untreated is a death sentence.
right. Okay.
So they are not comparable.
Right.
So the issue with I know people from our part of the world, and we have issues with bags. I know that. Okay, and it's a cultural. Okay, it's more of a cultural thing than But no one knows what is under his clothes.
No, I understand
So other people, unless he volunteers to tell them, nobody would know.
that. What do you mean by a cultural thing? Do you mean that Asian people tend to be more ill or have
No,
more?
they don't. There's there's misunderstanding of bags. Okay, it's not the first gentleman from that part of the world that I had to treat. Okay,
Yes, I
there's a
understand.
real mental blockage,
Mhm.
and one of the things that often people worry about. So, for example, people who are some religious and praying and things like that, they sometimes worry about cleanliness and all of these things, which are all not really.
Yeah, those things are
yeah.
bothering him.
Yeah.
Yes.
But it is not a contraindication. You know what I mean? This is attached there.
Okay.
So it is not, it's a more of a mental thing for someone to accept.
Right.
And it's because we don't talk about it in the community. People, there's not much awareness.
Mhm.
So if people don't talk about it, there's not an awareness, there's always a misunderstanding with things.
Mhm.
Because we don't, so I can guarantee you, he probably doesn't know many people who've had a bag.
There is about 700 people just in Croydon.
Mhm.
That's a lot of people, and we don't know about it. You wouldn't notice it. They're walking in the street, they're going and doing
Okay.
their things, going to work, and you wouldn't see it because, as
Yeah.
Mr. Mohammed's saying, you don't know what's happening under someone's clothes.
Mhm.
what's
I understand
there.
that, but
Yeah.
he in particular does know somebody who has gone through an operation and they've got a bag attached to them permanently now,
Yeah.
which they are having a difficult time with, and they wish that they hadn't gone through the operation.
Yeah.
And now this person's a lot younger than my father, and my father knows this person.
Yeah.
So for him to have that personal insight to somebody who's already gone through that, it's very, very difficult for him to
Yeah, no,
adjust to
yeah,
what has happened to that person and what could happen to him.
yeah. Bad news travels far, fast. People talk about bad things. You know what I mean? If someone has a bag and is happy with life, you won't hear about it. You know what I mean? So the other thing is that the people's situations are different. Okay, and we don't know the circumstances of that.
Right.
There are people who have to have a bag as an emergency. For example, people who have a gunshot injury to their tummy, sometimes you've got to give them a bag, So there's many
Okay.
reasons why bags can be formed. So it is difficult without knowing the particular circumstances. So you can't always compare your situation with someone else, you know what I mean? Because the circumstances are very different.
Okay.
Okay. So coming back to the situation is that we know, the whole purpose, when we're doing something, we try and help you. So the idea is that get rid of the cancer so that we can extend your life. Okay, that's what because without treatment, the cancer will affect your life expectancy and your quality of life. Now, doing surgery carries a risk. Okay, So how can we minimize the risk of the operation is what we are discussing.
Right.
And what I'm proposing is that one way of minimizing the risk of surgery is not to join the bowel. So that's the point I'm making. And so the reason I've suggested that is that joining the bowel together carries a risk. And one of the things that the joint leaks, and if it leaks, it leads to infection and everything else. And if someone is already weak, it is very unlikely they'll survive.
Okay, so you understand what they're saying? They're saying once your operation is done, जब ऑपरेशन का हिस्सा वो कैंसर का हिस्सा काट देंगे तो कहते हैं कि वो जो ना फिर आपकी हेल्थ के लिए वो ज़्यादा बेहतर है कि वो बैग लगा दें और बैग जो है वो परमानेंट टाइम के लिए लग जाएगा। तो वो कह रहे हैं कि वो कह रहे हैं कि आपका जिस्म इतना है नहीं क्योंकि आपको डायबिटीज़ भी है और आप जो हार्ट पेशेंट भी रह चुके हो, तो कहते हैं कि जो है आपके पास ऑप्शन, does he have the option of not wanting to have the bag?
No, obviously, this is what I would recommend. This is why we're here to talk about it.
Okay.
It's not. What I don't want to do is put him at risk. If I feel something is too much risk, I wouldn't really be happy to put him through that. You know what I mean?
Yes.
So it is important we do the right thing for him.
Okay.
And to try and understand. Look, I have no interest in him having a bag. You know what I mean? That's not. I want him to survive the operation and get back to the sort of life he was leading.
Yes.
Okay.
Yes.
That is what I want to do.
Yes, that's what we're intending as well.
That's exactly
and
it. And what
his plans are.
What the point I'm making is that I feel, knowing, because he had assessments, he's seen lots of people, we haven't rushed into this.
No.
And everything is that, there is a general concern that physiologically, in other words, his organs and everything don't have much reserve. So operation is a major trauma to the body. It stresses every organ. The heart, the lungs, the kidneys, everything.
Okay.
All right? So that's the risk of the operation. And if someone doesn't have good reserve, they run into heart problems, lung problems, kidney problems, all of these things.
During the operation?
It's usually after the operation, recovery, in the first few days after following the operation.
Okay.
So the difficulty is, if that's the situation, and by doing operation, we are going to stress his organs and there is some risk associated with it. How can we minimize the problem? Now, we can't do much to improve his heart.
Okay.
We can't get rid of the diabetes just like that.
Yes.
We can't improve, his mobility and everything like that. So you then have to look at the elements of the operation. Okay? The priority is to remove the bowel. The next step was to join the bowel. What I'm saying, that process of joining the bowel carries a risk to him. Okay? So, therefore, by not joining, we're actually doing everything we can to minimize the risk of the operation.
कह रहे हैं पहले ऑपरेशन के बाद आपके रिस्क है बहुत बड़ा, तो वो कह रहे हैं कि बैग लगाना ज़रूरी होगा क्योंकि वो बैग नहीं लगाएंगे और दो पाइप को दोबारा जोड़ने की कोशिश करेंगे तो उसमें जो है इन्फेक्शन और लीक होने के ज़्यादा चांस है और लीक और इन्फेक्शन होगा तो फिर वो जो है ना दोबारा कनेक्ट करने में बहुत मुश्किल होगा। तो वो कह रहे हैं कि उससे बचने के लिए आपकी तबीयत को नज़र में रखते हुए वो उनको बैग लगाना पड़ेगा।
कब तक ठीक नहीं हो सकता बाद में?
So he's now asking at a later date, once the things have healed up, is there a chance that the bag can be removed?
Because reversing the bag in that sort of scenario will also require a major operation to put it back together.
Right.
And the risks will be there again, so it's something you have to think about very carefully.
So there is a possibility?
There's always a possibility to reverse it. But the reality is, his health situation is such that it will be very unlikely.
Even because his health situation is not really going to improve with time. So the issues will still be there, what make the surgery risky.
With the bed, he can live normal life.
Yes.
Running, walking, traveling,
With
everything.
everything.
Yeah.
They only, it's mental. Acceptance is a mental thing.
Yeah, because he's very depressed mentally.
Mm.
That's why.
So, of course he can function. In
Yeah.
fact, it will be easier
It's
for
second
him.
option. He don't want operation. It's a big risk.
How
Yes.
long will it take before the
Very
cancer
difficult
spreads?
I wouldn't recommend that. That's a bad route.
I mean, you're more experienced in this
Yeah.
field, so
I
would
mean,
you be able to
we're
give us a
talking
rough
about probably a few months, maybe about a year.
few months to a year he
Yeah.
will have before it starts spreading into
Well,
his
no,
organs?
before
and-
he will notice problems. The other problem is that locally it grows bigger and it will cause blockage in the bowel.
Okay.
And if that
Making
happens,
making the bowel,
Yeah.
the
passage.
passage narrower, and
So,
causing more.
so these are the two problems. One is a blockage in the bowel. The other one is a spread of the cancer.
दो इश्यूज है ना, जिधर वो दाना निकला है कैंसर का वो ज़्यादा फूल के बड़ा हो जाएगा, और फिर जिधर से आपकी पोटी आती है वो जो है ना उसका होल बिल्कुल छोटा हो जाएगा, और उधर से आपको बहुत प्रॉब्लम्स होगी।
ब्लॉक हो
तो-
जाएगा जो।
तो वो है, और फिर आपका जो हार्ट की
ऑपरेशन
कंडीशन
जल्दी
है
हो
उसका।
सकता है।
How soon will the operation take place?
Well, maybe sometime this month. In the next few weeks, we need to,
Possibly, like you said, nearer to the end of September,
yeah,
beginning
yeah,
of October.
Yeah.
If you have any cancellation, so you can call him.
Yeah, I mean, at the moment there is a possibility we may do him on the 17th of September,
Okay.
but that's provisional. We haven't. I'm trying to fit things. So
17th.
it's not a long to wait. Okay, but it is important you understand. What is. I wouldn't be having this conversation
Mm-hmm.
if you were active and fully mobile, fully. You know what I mean?
I understand. I mean,
I'm having this
recently
discussion
he's,
because I'm worried about you.
I mean,
because of
recently
your
he's
health.
changed his diet and he's doing more
Yeah,
exercise, but like you said, it's
Yeah, and that's the only reason.
it's a lot for him to take on in a short period of
Yeah.
time.
And diabetes damages all the organs. We know he's already had a heart operation. It is very difficult. His organs don't have much reserve.
Doesn't have much reserve, as in doesn't have much strength.
So, for example, everything in life you do, if you're not used to walking and you walk, you're going to get tired very quickly.
Yes.
But if you're used to walking several miles a day,
Mm-hmm.
Walking 10 minutes is not a big deal.
No.
You know what I mean?
yes.
Simply because you have capacity to walk that far. You've got a lot
Okay.
in reserve. That's
Okay.
what I'm saying.
Capacity. Okay.
Surgery will stress the system.
Okay.
And
It's a major operation.
it is
like
a
you
big
said.
deal. It really
It's
is.
to cut out the cancer part, and then
And that's it. Cut cancer, but don't take any unnecessary risk.
and to see whether it's his body's fit enough for him to have the rejoining. If not, then obviously
No,
you're going
I-
to attach a bag, right?
Yeah, I really think the bag is going to be a permanent thing. Sorry,
Yeah, she's worried about it.
Hmm?
She too much worry.
yeah, but she cares about you.
For back.
Huh?
She's worried about back.
About the bag.
No, she's
Very
worried
long
about his
life.
his,
Yeah,
his
yeah.
life in general. It's not
Yeah.
just the
That's
bag.
yes.
It's
not,
a new lifestyle that everyone's going to have to get used to and adapt to for his benefit. But it's
think
just we don't
mean,
want
the bag
him.
probably
We
you
don't
have
want
to
the
help him.
difficulties. We don't mind the issues. We don't mind changing and taking care of him. But it's him himself
Yeah.
that he's a very
independent
independent
Yeah,
minded.
I
So
can see.
he is extremely. He doesn't put it on you. If you don't see it, then he won't tell you what's going on. He just keep quiet about it and deal with it.
Yeah.
So he's very stubborn in that way. And,
That's probably a
we're,
good idea to speak with the stoma nurses. They can show you the bag. They can explain you how it's managed a bit more in detail.
okay.
What
तो
you think
बैग जो
about
है
it?
बैग लगने की ज़्यादा चांस है. बैग नहीं लगाएंगे तो वो कहते हैं जब वो काट पीट करेंगे तो आपकी अंदर से जो बॉडी होगी उस पर काफ़ी स्ट्रेस पड़ेगा ऑपरेशन के दौरान.
डॉक्टर बेहतर जानते हैं वो उनको जो ठीक लग रहा है. What is better you know.
I mean, I wouldn't.
It depends on you.
In
Everything.
all honesty, as I said to you, I do a lot of these operations, and obviously I meet the people beforehand. This is a big operation. It's not this simple thing that we fix, you go home a day. He'll be in the hospital for a week, maybe 10 days, maybe longer. So it's a big thing. And, you know, my interest is to make sure that he gets out of hospital safely. So that's the only reason why I'm suggesting